When we were in the peak of pandemic last year, many doctors closed their office doors. Unless it was absolutely necessary to see a patient in person, appointments were held by phone or by video. And that's also the business model of Lumeca, a Regina-based virtual health company that was still finding its stride pre-pandemic. Then, when things shut down, the Saskatchewan government stepped in and made it a service available to all residents. Tom Douglas is Lumeca's COO and joins me now. Hi, Tom.
Hi, Sam.
Tell me about that pivot when you went from trying to onboard new customers to becoming a provincial health service.
Well, I think we've always envisioned virtual care to be publicly insured. Initially, when it wasn't, we served a need in the market that the public system wasn't satisfying. There were large companies with remote workforces, and organizations that weren't well suited to the current paradigm. And so we were providing them with virtual care services. When those services became publicly insured, we were able to open it up to everyone with a valid Saskatchewan health card.
So since March of 2020, how have you seen patients and people adapt and use your app?
Well, like any new technology, you've got early adopters and then you've got laggards. Our biggest fans in Saskatchewan actually tend to be mothers and caregivers in general. So not just mothers and fathers, I guess, on behalf of their children, but caregivers on behalf of their elderly parents. That's actually one of the most common rave reviews that we get, is the child of an elderly parent with a mobility issue or something of that sort, that are absolutely thrilled that they were able to set up an appointment on behalf of their parent in the comfort of their own home, and to also be on that call with their parent to help them with comprehension and basically act as their caregiver. It's helped keep people out of ERs as well. We've saved patients a lot of time and travel to physician offices, about 1 million kilometers of drive time since the pandemic started, which works out to about, we estimate, around 220 metric tons of CO2. So it's a lot of change in a very short amount of time.
Tell me about the physician side and how that's changed.
Well, it's nuanced. Again, like patients, you have early adopters and you have laggards. At the beginning, we had hundreds of physicians reach out to us being very excited about our platform, and then we've had others who've been more conservative about virtual care in general. I think the reality is that the medical system has always been slow to change. And that's because the medical system does things in an evidence-based way. One example I often quote is the stethoscope or hand washing. Both of those took nearly 20 years for widespread adoption among physicians in the 19th century. Looking back now, it's pretty obvious that those things are good for medicine. And I think that we're obviously going to move faster than that. But maybe in 5 years, we'll see a more matured model of virtual care and more adoption widespread among physicians. There's still a fair amount of physicians that are using the phone as opposed to video. And obviously video provides higher fidelity information. There's more things a physician can do. And that brings about the next important question, which is where things are heading, is what's appropriate to do virtually versus what's appropriate to treat in person. And so that's really where things are headed.
Thanks so much for your time, Tom.
You're very welcome, Sam.